Respiratory therapists are required to possess excellent clinical skills in order to deliver high-quality care to their patients. However, they must also provide services in an ethical way in accordance with the law. This can be difficult to do, as there are many implications that need to be considered when providing respiratory care. RTs must regularly make choices that have both ethical and legal consequences. This video will help you develop a better understanding of how to be an ethical respiratory therapist. So, if you're ready, let's get into it. According to the AARC, there are several practices that respiratory therapists can adhere to in order to ensure that they are acting ethical and lawfully while on the job. The first is to be objective, trustworthy, and reflect integrity. So basically just be honest. That's what it all boils down to. Integrity is the quality of being honest and having strong moral principles in everything you do. Trust your coworkers to fulfill their job duties completely, and you do the same. This goes a long way with your patients and other members of the healthcare team. Number 2 is to never stop learning. This is required, so you might as well embrace it. Lifelong education is important in all aspects of life. We should always strive to gain knowledge and learn new skills in the field of respiratory care. Depending on the state of your licensure, you will be required to obtain a certain amount of continuing education, CEUs, each year. This is not only something everyone should do, it is a requirement in order to maintain your license. Number 3 is to provide care with your scope of practice. What this basically means is that you should stay in your lane. You wouldn't want a nurse to stick an ABG for you, so you shouldn't be trying to start an IV for them. You get the idea. Even if it's something small, if it's not within your scope of practice, don't do it. This not only protects you, but also ensures the safety of your patients. Next up is to protect the personal rights of the patient. This goes without saying, but always keep your patient's information private. This means that you should never share any patient information without their consent unless it's required by law. Unfortunately, this is something that does occur far too often amongst healthcare workers. Number 5, don't discriminate. You should treat all patients equally and provide high-quality care, no matter their background. Here's a simple rule of thumb. Treat each patient as if they were one of your own family members. Because remember, they are someone's loved one, and it is your job to care for all patients equally. Next up is to promote disease prevention and wellness. This means that you should do your part in disease prevention, and it's really not that hard. Be sure to wash your hands before and after each patient interaction. Scrub in and scrub out whatever necessary. Wear a mask, gown, and other PPE when it's required. It goes without saying that this is not only to protect the patient, but also protect your health and well-being. Number 7 is to participate in no illegal or unethical acts. I mean, yeah, don't do illegal things at work. Got it? Seriously though. Don't steal from your employer, don't give yourself a breathing treatment while at work. Don't show up to work under the influence. Use common sense, people. This also includes reporting unlawful acts that you may witness while on the job. Now, this may be difficult at times, especially if it's from a coworker who is also a friend. However, if you see that their actions can potentially bring harm to a patient, it is your ethical and legal obligation to report the actions to a superior. Number 8 is to comply with the state and federal laws. We all must abide by the same federal laws in order to maintain the credentials that give us the right to practice respiratory care. However, some states may have laws that vary slightly from others. It's your responsibility to learn and uphold the laws of the state in which you choose to practice. This applies to acquiring and maintaining your license to practice in that state as well. Next up is to avoid conduct that creates a conflict of interests. A conflict of interests arises when a person has a personal interest that could influence their professional judgment. For example, A respiratory therapist might have a financial interest in a company that manufactures respiratory equipment. If they were to recommend this equipment to their patients, they would be engaging in a conflict of interest. The best way to avoid this is to be transparent with your patients. To be safe, simply avoid taking any action that could be interpreted as a conflict of interest. And number 10 is to promote stewardship of resources. One way to promote stewardship of resources is to use equipment and supplies in a responsible manner. For example, you should use materials in a way that minimizes waste and maximizes the benefits for your patients. You can also make sure to use the most up-to-date and evidence-based practices. Doing so helps ensure that you're providing high-quality respiratory care. Again, we got the idea for this video from content that was put out by the AARC. If you're interested, I'll drop a link to it down below in the description. But real quick, if you don't mind, do me a huge favor and hit the like button. It really helps support the channel, and I greatly appreciate it. And you might as well go ahead and subscribe for more videos like this. Hopefully, what you learned in this video was useful and can help you work as an honest and ethical respiratory therapist over the course of your career. If so, be sure to let us know down in the comments section below. And if you want to dive even deeper, we do have a full guide on our website. I'll drop a link to that as well right below this video down in the description. And one final reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.